So heads popping in. So what I'm going to do is get us into live on Facebook. So just take a couple seconds to get.
I'm going to San Francisco. I'm putting me in San Francisco.
No. There's resilience. Chat with Denise Dolcine. Got it in. All right. And we're going to go live. So last time I did this, it was a little funky. I didn't realize like they changed some things and there was like an immediate feedback from Facebook. Like it's literally recording it and putting it up as you're speaking.
Oh, like it's a Facebook Live.
Yeah. And there was some feedback.
Like it's a Facebook Live. Oh, I hear the feedback.
Yeah. So what I've had to learn to do is decrease the volume on Facebook, and then you and I can just have our conversation. It'll be going on Facebook, but it won't be like hearing two at the same time. It was quite crazy the first time I did it. Oh, that's sweet. Love it.
Yeah, he's like, I'm gonna go downstairs.
Yeah. Okay.
Okay, you go do that.
So, my dear, I'm not going to keep you for long. I know that you have, multiple hats that you're wearing, as many women and especially nurses do. So, first and foremost, we're going to start with just kind of introducing who you are and why we're here together. So, for those of you here with us, my name is Shante Kumar. I'm here with the beautiful, the incomparable Denise Dolcini. And she is an RN currently working with the in corrections. And so she also has the vaunted I don't know if I should say, vaunted position of also working as a supervisor. So she's going to be able to give us kind of, some insights in regards to challenges in nursing and in the nursing profession, and particularly with regards to the changes that we're seeing in nursing, lots of nurses leaving, lots of new nurses coming in, and what that means for correctional nursing in particular, and the specific challenges they face. Also, if you want to share, kind of some insights and, maybe the perks of correctional nursing, because I know there is a shortage of nurses going into that field, a lot of times due to misconceptions and misunderstandings in regards to the actual workflow. People assume it's going to be just like it is in the movies with, the inmates wilding out all the time. And the large majority of the time, the inmates are fine. It's the staff we got to worry about wilding out on us. So without further ado, I'm going to let Denise introduce herself and let us know what got you into nursing and your nursing journey into corrections.
Oh, shoot. Well,
that's not a loaded question.
Do you have like 3 hours? No,
Yeah,
just
right?
kidding. Well, I mean, my journey into nursing originally started in high school, really. I had many trips to the hospital for family illnesses and things, and it was really intriguing me to learn about what was happening or how hospitals work. So I did an ROP program.
What's that?
It's called Regional Occupations Program. When you're a senior in high school, you can get credit for, it's kind of like on the job training, where you kind of dabble, you get to learn a certain type of trade and see if you really want to do that when you go into college, so you don't waste your money going into something you're not really actually passionate about. So I figured I'd do hospital occupations and go see what nurses do. And I really loved it. So I decided to go that route when I went into college and started doing all my prerequisites for nursing. Found out it was very hard to get into nursing school. They had lotteries.
Yeah.
So when I completed all my prerequisites, I wasn't getting into any of the RN programs. So I found out about Western Career College and just went the LVN route and paid for private school. And that's really what started my corrections career. Was they had supervisors from Folsom State Prison
Mhm.
come into the college and do a presentation on corrections nursing. And they had a PowerPoint presentation. It was back when there was a really big nursing shortage, so they were trying to recruit from all of the nursing schools. And basically I'm like, oh wow, that looks interesting, and all the benefits that come with working for the state, the 14 paid holidays, the you know, safety pay for retirement, the shiny, you know, um, dental and healthcare packages you get right away.
Yeah,
And I
you
was
get
at this
great
time.
packages.
Oh yeah.
Yeah, the benefits are, like, unparalleled, yeah.
Mhm. And so, and me ripe at the ripe age of 21, I was like, oh well, I don't really care about that stuff, but the paid holidays, yes, sign me up. And so I went and applied and I got hired with Folsom State Prison as an LVN. And of course, in the prison system, it's nice because when I was in nursing school, skilled nursing is not for everybody.
It is not.
I to me it was kind of a depressing situation for me. So I was like, this, I don't think I can be around, so much sickness and sadness, and I mean I was 21 years old. I was barely alive myself. So I was like, okay, well, if I go into the prison system, I'm not having to deal with sickness so much. It's more of prisoners. They're adults that are relatively healthy but might have issues, especially at Folsom, because a lot of those people are, well, I mean, they're sick, but they're not sick mentally health, or they don't have a lot of mental health problems.
Yeah.
They're relatively healthy. So I liked that, but it really, when I got there, I was like, well, you're really limited as an LVN on what you can do. You learn all these cool skills in school, but you can't use them
Yeah.
because the RNs really get to do a lot of that stuff. So I went back for my RN license, and luckily, well, I was able to take a lot of vacation time and take extra time off because of those benefits so that I could go to school. And my schedule, I worked the 1 p.m. to 9 p.m. shift. So I would go to school in the morning and then go to work at night. So I was able to complete my schooling without having to take too much time off of work. And um, they were very supportive, my supervisors there, of my career mobility and advancing myself. So, on my downtime in between med passes, I would do my studying and my homework. As long as it's related to nursing and it's bettering my nursing career, they didn't really care as long as I got my work done.
Yeah.
And I was lucky enough to get into the LVN to RN BS, or LVN to BSN program through Indiana State.
Nice.
So it was all online. So I
Nice.
didn't really have to go be somewhere to be in class.
Yeah.
It was all self-study. I kind of had to discipline myself to be an online learner. That's not very easy, as people during COVID must have realized, when a lot of programs and classes went to online base. It's not easy. You really have to be a self-directed learner, and that was one skill I developed and learned for myself through that. Um, you can't slack, because you slack, it's your own education. You don't have someone holding your hand or a professor readily available to you. So that was a nice experience, but it also helped me for when I went and got my master's degree, because
Mhm.
that was all online.
Yeah.
But and I was like, oh, this is like I know this like the back of my hand, doing discussion boards and
Yes.
writing papers.
Yeah.
So,
That's how I got my master's too, is online. It
yeah,
was before a lot of people were doing it online, so I yeah, it was very interesting experience. Yeah. But please,
yeah.
please.
And I actually, even though I was California based, there were students from all over the United States in the Indiana State program,
Mm.
which is very interesting because I met people who live in California and we're in the same program and from different areas that I probably would have never met in my life.
Yeah.
And we all went to Napa for a lab that we all had to do. They hosted a lab in Napa at Napa State Hospital, where it was like one of those simulation labs with a
Mhm.
patient, mannequin, live mannequin type deal,
Yeah. They're like, oh,
that was
yeah, they're like might jump on you or something. Yeah.
right. And it was lifelike, and you actually had to insert IVs in it and,
Yeah.
do chest compressions on it if and yeah, it was pretty cool. But um that was like the closest I got to having classmates that I got to see. Other than that, online, you're just chatting with each other and answering people's discussion boards. But yeah, it's hard to work full time and go to school.
Hmm.
Um,
And
it's
now you
very
have a little one too.
yeah,
Yeah.
that too.
Yeah.
But luckily I did all of that. I finished all my schooling before I had her. I made sure that I planned that out. But it it's it, it's really beneficial to have those abilities to have online schooling, and for those who can't not work full time and
Yeah.
still have to work a job, and it's not very conducive to learning, being in school if you work full time. So yeah, but working in corrections in general, I always tell everybody, because I've now got 15 years in
Mhm.
that, their main question is, oh my gosh, how do you do it? And you know you just have to have a certain way of thinking, you know I've never felt unsafe a day in my life in the prison. If you're the safest place you can be in is in prison, because you have
All the
officers
guards. Yeah. All over the place.
everywhere.
Yeah.
Absolutely. And the inmates are taken out of their element. So what I mean by is, when you go into an ER in a hospital, you don't know what's going to walk through those doors, or what they're on, and or what they have that can hurt you. These people are just, randoms from out of on the street. You don't know who they are. In a prison, I know everything about them. I can read all of their cases, what they've done. I already know what diseases they have, I can read up on them. And a lot of times, where I'm at right now at CSP it's a little harder because I don't directly work with the inmates being a supervisor. But when I was a line staff, when I was an RN, your patients. They live there. So you're seeing them constantly.
And
You
the
have
patients there, they tended to really, most of the time, appreciate the nurses because they saw us as like, people who cared, and
Mhm.
yeah, so they might give you some grief, but a lot of times they really weren't, because they
Mhm.
knew this is a person that I get my medicines
Mhm.
from. This is the
Mhm.
person who is like going to be saving my life. So like,
Mhm.
yeah, right. Let's kind of get on the good side of the nursing personnel for the most
They
part.
don't bite the hand that feeds them,
Exactly.
type deal.
Yeah.
But it also requires establishing a rapport and being consistent
And clear
and
boundaries.
fair and
Very,
clear boundaries, and the same across the board to all inmates. The moment you start to act like you have favoritism, they'll chew you right up.
yep.
And that's why corrections also puts you through extensive training on over familiarity, boundary setting, the anatomy of a setup,
Oh, yes.
inmates.
Such a great book. Love that book.
Oh my gosh,
Yeah.
yeah. And so ways to protect yourself so you don't get yourself put in, because I know so many people get put in those situations that they don't even mean to do it.
Yeah.
It just ends up happening because maybe they might be too nice of a person, or,
Or they're
and
not comfortable saying no. A lot. That's one
that.
thing that I've learned, a lot, especially in corrections and in nursing, is learning how to say no and set those boundaries, but still come across like as being authentic and caring, and letting people know, hey, I'm still here for you. And I'm glad you brought that up, because that's one of the things that we talk about in our event, especially with nurses. You know, a lot of times there's boundary violations that occur either with your patients or a supervisor or a peer or even in our families. And we're so used to being that person that like everyone comes to for advice and for help and for care. Sometimes we forget that no is therapeutic and no
Mhm.
is a healthy, good word, right? And we need to learn
Absolutely.
how to incorporate no in our lives so that there's a joy and lightness to it. And
Mhm.
it still allows us to feel like we're still helping, that we're still meeting our calling in caring for
Mhm.
other individuals. And
Mhm.
that's definitely something that often comes up when we have our nurse resilience event. And so I'm so
Mhm.
glad that you mentioned that, because it's a
Mhm.
very key piece of becoming a more well-rounded person and becoming a stepping into your leadership, because there's no way you can
Mhm.
get into leadership if you don't know how to utilize no in a healthy and in a
Constructive.
constructive manner. Exactly. So
Mhm.
you're now a supervisor, and so you know what that's like. What's been some of the differences and challenges for you from going from working with the line staff to now working with the staff in particular?
So, you know, it helps that I stepped into a leadership role at a completely new institution where I didn't know anybody.
Mm,
It's hard going from somebody's peer to somebody's superior,
yeah.
because once you have that rapport that, oh, we have a working relationship, or cool, she's my work bestie or he is my work bestie, these are my friends, but now I'm a supervisor, you know, it is a lot harder when you're at that same institution.
Mhm.
I myself haven't really had a lot of bound or issue barriers, because I transferred to a new institution and promoted. So I don't have any of those people as my friends. So I don't have that inner turmoil or the
Mhm.
moral, you know, I was like, okay, well, here's policy. This is what I'm used to, you know. Um, but I also don't come at them as, because I was them once.
Yeah.
You know,
Yeah.
I I love the fact that I have that experience and that knowledge that, okay, I was them once and this is what I would want if I was being managed or, you know, led. So I'm going to do the same thing with them.
Mhm.
So um that's the one thing that I've had to, when I'm switching my hat from being a peer to a supervisor, is understanding those boundaries and understanding that you can't effectively lead somebody if you're always their friend per se. Sometimes you have to, there's a mission and a goal at hand, and you need to make sure that that's fulfilled, because you are in that leadership role, in that management role. And the moment you let things slide, or, you know, things get lax and they don't get dealt with, or dealt with the wrong way, and you don't do anything about it, it causes further issues down the road.
Mhm.
And so you have to kind of nip it in the bud right away, and but still be a person, treat them
Right.
like a person. You know, I've noticed, you know, especially where I've been put in all different areas of the institution where I'm managing new staff groups. You know, I've been working the managing an inpatient unit. I managed the emergency TTA, you know, and now I'm managing, you know, a primary care clinic.
Wait,
And
so for those
so,
that don't know, can you explain a little bit about how in corrections it's almost like its own little city with regards to healthcare? Because you know, you don't go to the ER and then go to different floors for things, right? So can you
Mhm.
you know, well, unless you do have to send people to the ER, but otherwise, and you know, like you said, we kind of have our own in the TTA. So
Mhm.
so can you explain a little bit to those who don't know and may be interested in corrections? Like, oh, wait, there's different areas that I can go
Mhm.
into? Because that was something new for me that I didn't
Mhm.
realize was an option and was available.
Mhm. Well, registered nurses are utilized in different capacities within. Really, I feel the nurses run the institution. Everything falls on nursing.
Yes, it does.
Um,
All the bad stuff. We don't
just
get any
because
of the credit. What the
I
heck?
mean, it's like, oh, just because we are the ones that make the decisions. Doctors don't make the decisions. We tell them what we're doing and they agree. We follow protocol.
We're
Doctors will
there
see their
24/7 and we're
yeah, pretty
seeing the progression or the non-progression in treatment and in plans and in all of that. Yeah.
because it all starts with the nurse. When an inmate arrives to the institution, they will see a nurse first before they will see a doctor.
Yeah.
We're kind of the buffer, but doctors really only see chronic care issues on their own. They have regular routine chronic care appointments, or they'll have episodic care that is driven from the nurses clinical judgment or assessment from what they found is wrong with the patient. So it's never an inmate has a problem and they immediately go see a doctor. No, they'll see the nurse first. So we're kind of the heart and backbone of
Yeah, we're the gatekeepers and
healthcare.
yeah. Yeah.
And so whether it be a primary care clinic, whether it be an inpatient unit, or whether it be emergency, the nurses are all running those units. And then the doctors will oversee, the whole person care, but they're not directly caring for the patient. They will only care for the patient if there's issues. So, basically, when I say inpatient, specifically to CSP SAC where I work, the prison, it's mental health crisis bed. So in psychiatric inpatient, and then or we have 2 medical beds. So if somebody returns back to the prison from having a surgical procedure that can't go, kind of like a subacute situation where they can't fully be on their own because they have IV antibiotics they're on, or
It's like a step down.
it's a step down until they can go be on their own in their own housing unit. Basically based off their needs, we've had, people on wound vacs. Maybe they might just have had a really extensive surgery and they have a wound vac. People, a lot of times, if they've had, we get the wonderful hunger strikes, hunger strikes when an inmate decides not to want to eat food at all. And then they start losing a certain amount of weight over a certain amount of time. They go move into the medical beds in CTC to make sure, that they're still staying safe and they're being monitored. Or vice versa, they're being documented as not as eating certain amount of meals, but yet they're not losing weight. So the doctors send them to the medical units to monitor if they're actually not eating, because in their housing units, they still have access to canteen and food within their cell, but just because we can't see them eat it doesn't mean that they're not eating. There's other reasons, patients get moved into inpatient, but those are the main reasons. And then you have your emergency area. We call it the triage and treatment area, because for us, we cannot, we often don't treat emergency issues. We stabilize and we transfer. So we, in that capacity, act more like an EMT. We identify the acute issues. We stabilize them as far as basic first aid and establishing IVs and keeping them alive long enough to be picked up by an EMT or ambulance company and take them to the hospital to get their higher level of care. Because we are not equipped within our facility to deal with, say, if someone's having a heart attack and they need to go and get into the cath lab. We don't have one of those.
Right.
For for their care. Say somebody overdosed. We can hit them with a bunch of Narcan, but we can't monitor them for long enough and give them, fluids to keep them from relapsing, because those Narcan only stays and covers the opiate cells for a certain amount of time, right? Let's see, what else is there that anytime someone's stabbed, we can't surgically repair any wounds. We don't have an OR. So we have to send all those patients out. Anytime there's any kind of trauma, we can't handle it. We just plug up the holes. We breathe for the patients if they're not breathing,
Yeah.
and we keep them going until we can get them to the hospital.
Yes. So
But
what has been your most favorite thing about being in corrections as a nurse, and what has been the most challenging thing about being in corrections as a nurse?
I think the autonomy is my favorite because I actually do feel like I do a lot of work and I am important. I'm very important to the healthcare team, and every
Very
nurse
fulfilling.
is, yes.
Yeah. Yeah.
It requires a higher level of clinical judgment when you're the one making the decisions and you don't have someone there to bounce the ideas off. You don't have a doctor saying, okay, do this, do that. We can always anticipate. Nurses can always anticipate what a doctor's going to order. Here, we already have protocol. We know what they're going to order. In a hospital, the doctor still does all the work. You follow the orders. Us, we are it. I like that autonomy.
Do you find though that is sometimes almost a double-edged sword? Because
Absolutely, because not all nurses have sound clinical judgment. And especially in corrections, we hire a lot of new nurses.
Yeah.
So, because, like I said, everybody gets out of nursing school and wants to go work the Kaiser jobs. They want to do the labor and delivery or,
ER. ER is huge. I remember when I was in
ER,
everybody
OR,
went ER, or they wanted, labor and delivery.
or the PACU, or, they want to do all those jobs, but they don't necessarily want to come work with inmates. They're criminals. Who wants to work on criminals? You're not really doing God's work if you're, keeping the
bad guys going.
The bad guys going, yeah, right.
But people forget that they're humans, and the large majority of them, when you get them
they just got
talking,
caught. You don't know anybody in the hospital.
seriously, that's
You don't know if they're a criminal or not.
Okay, there's a lot of them that are criminals, right? RNs have been known to, to take meds and to like, right? And doctors and therapists, people have done some things that were totally inappropriate outside of prisons, and that's how we know, because they did get caught, but many do it and they don't. And I think it's a key thing that you just brought up, because a lot of times people forget there's still a human being in that person. That's still a soul. And you most certainly are doing God's work by looking after those who might be considered less than by many others in society, right? They're less worthy, they're less important, they're less human, even because they're in prison, so they must be horrible evil people. And just I was at Folsom, and I had the beautiful experience of talking with a group of inmates who are actually in a program to help them to it's kind of like 12 steps, but it has nothing to do with actual alcohol or addiction. It's really about getting them ready to leave the prison system. And one of the things they have to do is like victim understanding, and they have to do a lot of accountability. And one of the men who was in there was actually an ex-cop, and he was in there because he had there was a lot of loud stuff going on outside of his house, and he was like got really mad and irritated. And then I guess somebody came to his door and started knocking on the door or being really rude and loud. So he yelled at them to leave, and they didn't leave, or what happened. There ended up being a verbal confrontation. And then he got out his gun. He didn't even mean to shoot the person. But, once you get a gun out, I'm sorry, if it's locked and loaded, you better be ready for it to go off. That's just why you got it. Let's be honest.
Unless you have the safety on,
Right.
like
And, he pulled it out and he ended up shooting the person and ended up killing them. So
oh
his
no.
life was over in an instant, right? And this is a person who was considered a pillar of the community. He was, I think the captain of, not the captain, excuse me, he was a coach for the football little league. And, he was a volunteer with the church and talking to the youth groups. I mean, he was very active in the society and in his community. He ended up, getting a divorce from his wife. He has a strange relationships with his kids now, and he admitted when he first got in, obviously it was really hard because now he was one of the bad guys and he has spent his life putting away all the bad guys, right?
Oh yeah.
So he had a lot to deal with and overcome. And a big part of that was accountability, because a part of his brain was like, well, if they hadn't done this and if they had listened to me, if they hadn't, did what they did, then I wouldn't have had to get out there. And that's kind of what this program did. It helped him to come to grips and understanding with his part and his role and all that. And the reason I even bring it up is because a lot of the people who are in the prison are like that. Sure, there's some people who have been, scamming and scheming from day one, but the
Or
large
gang
majority,
members,
right. And
people
even
who are
then,
married
a
to
lot of
the
times it's because of stuff in the environment or lack of things in the environment, lack of support. And so if you're growing up thinking or hearing that you're nothing and you don't deserve anything and you can't do anything, it's very difficult to overcome that. And then you have people like this ex-cop who, just did a huge mistake and now has this prison sentence over his head.
well,
Deal with.
and not only that is you are one person going into the prison system, you're not the same person coming out.
Right.
Because once you're in there, you are changed. You have to adapt to survive in a
Yes.
prison environment. If
Yes.
you were not part of a gang before, you better be part of one now because it's survival. And that's what they do. They draw you in. You've got to be affiliated. You got to do something to stay safe. And that's a true thing,
Yeah.
and that's what sucks is you end up having your whole personality change. If you ever do have the ability to parole, you're not the same person. And that's why wives do, divorce their husbands who are in prison. Maybe they burn their bridges with their family because maybe they might do that on purpose so that it protects the family from what they've become.
Yeah. Yeah. But there is a turnaround, because I've actually been in so many great groups, like at Solano. They have an amazing peer-led group. And those gentlemen are so on it. Like they're helping one another through all of that. And they
They
actually
have one of those at Folsom too.
yeah. If you want to leave
Peer
the
ed.
prison, not leave the prison, excuse me, if you want to leave the gang life and you want to do it in a safe way, they can help you to navigate that. And you have a whole group of people who have also done it, and they help you to start living a life so that when you get out, you're more aligned with who you really want to be and who you're learning you really are. Because there are some good things, that people can do in the prisons that they didn't know they could do before. Like they can get their GED, they can even get higher level of education, right?
They learn trades,
You can learn trades.
AutoCAD and drafting and building buildings
Yeah.
and things.
Yeah, one gentleman was actually doing glasses. He was actually creating the lenses for glasses. People don't know that. So you have some people who stay on kind of the underbelly, and that's where they like to be. That's where they thrive. That's where they're at. But the large majority, and I'm just saying it for those people who are maybe thinking about corrections, the large majority of the people who are in there don't necessarily want to stay in there. They do want to get out, and they do want to have a better life than what they came in there with. A lot of times though, they're lost and they don't know how to do that, and they don't know what that looks like.
A
And
lot of the facilities are each facility houses a different type of inmate too.
yes,
I mean,
And then there's that.
that's, I will say at SAC, we are the mental health hub.
Yeah.
So your statement is very true in most institutions. In SAC, a lot of them are, unfortunately, we'll call them the antisocial personalities, the ones you can't medicate, the ones that
Yes.
probably will never do anything but be in prison.
Yeah, because they're just
Be-
antisocial is the nice way of saying, honestly, clinical asshole.
Basically, I call them so.
For that. There's no meds for that. I wish there was, but you're right.
There are no meds. They're rebels without a cause.
Yeah.
They're just there to make people's life miserable because they're miserable.
Yes, exactly.
And there's nothing really necessarily making them miserable.
Nope.
It's just the chemical transmitters in their brains has them in that heightened state of I suck, or and
yeah,
like key and point, that here's one inmate, we had in one of our our inpatient units who was suffering from diabetic foot ulcers and infections and didn't want to be treated. He he didn't want to kill himself, but he also didn't want treatment. So it was more of like
a SI, really.
What was
like
that?
A passive SI. Yeah.
Yeah, he doesn't want to be treated, but it's kind of like a masochism type thing. He wants the pain. Like maybe he might be punishing himself for A, B, and C reasons. But he would be nice and talk to you straight to your face and like have normal conversations with you. And then in the next minute, he's punching you or kicking you. Like he kicked a couple of my nurses. He's gassed a couple of psych staff. And then it got to the point where his illness was so bad, he had necrotizing fasciitis in his leg, and he had extensive surgeries. Finally, he agreed to let us send him to the hospital to get surgeries done. And when he came back, he wasn't following the plan of care. He was walking on his foot when he shouldn't be. He was bleeding all over the cell because he wasn't letting his wounds heal. So then we ended up sending him back out, and he ended up transferring to San Quentin. And I found out not too long ago he ultimately died. He was supposed to have a BKA.
Yeah.
And he kept refusing it.
Oh.
And I think he ended up going septic and dying. Yeah. So, but these are the type of people that you have to deal with in this persistent non-compliance, and just straight up neglecting themselves, ignoring your education. And the state, I don't care how many times you have to tell them, you keep telling them, you have to prove that we're trying. The prison law office is constantly looking at cases to see where we might have dropped the ball on somebody, even though we have documented 20 visits that this person's refusing his doctor's care. Well, what did we do? Why weren't we doing more? That's
like,
the
rather
one
than like strapping someone into a bed and taking away their rights. You can only do so much. Yeah.
Your question of what is one of the downsides of working corrections, I will tell you exactly that. That is the downside. The fact that you can document until you're black and blue and they will find something wrong with what you did. You're constantly under a microscope. You have to double, triple, quadruple document every single thing you do. And you have to go above and beyond even community standard for these inmates because they are wards of the state. You're all they got, and you better do it right. And the state is paying us to do it, which I get that. But, it's one of those moral things that I have problems with. It's like I give better care to these inmates than my mom ever did when she had cancer. I see our healthcare system on the outsides don't nearly give as much as they do as we give to the inmates. And it also causes way more work on the people who work for the state. I mean,
it's so much
and
more
we're not
detrimental to
even
your work.
compensated
Yeah.
adequately for it. I will
I'm
tell
saying
you,
it's
we
actually
are
detrimental to your health and well-being because you've got nurses who end up being like really stressed and like worried about looking over their shoulder and making sure, you know what I mean? Like everything that they do is, top tier. Because if it's not, God forbid, you're worried about your license being pulled or something happening with your job, right? And it's
here's
a constant state of stress and overwhelm that is
there's
on top
armchair
of
quarterbacking everywhere.
yeah.
Someone analyzing what you did to see what you did wrong. I will tell you a prime example. We were so short staffed. I was working as I was a supervisor working in the TTA because we were short staffed. I had a guy who was he had overdosed and he was vomiting left and right. Not with it at all. I'm suctioning him. We're trying to get the IV established. We already called the code 3 ambulance to come and pick this guy up. So we have a narrow time frame to get all this done before to have him prepared to send out. So I'm over here, I'm suctioning the guy. The guy's seizing, and then my other nurse is trying to get the IV in. We do all of this, and then finally the ambulance gets there. We transfer care and give report, and he goes and he's fine. I mean, the inmate ended up fine. But later on, when other supervisors were doing the review of the case, the EMR transfer, they were trying to chastise us because we waited 15 minutes to call and tell the doctor that we sent the guy out. Like they wanted us to do an 844.
No.
They wanted us to sign an 844 that we were educated on timely report to the PCP. And I'm sitting here, I'm sorry, because from the time we called the code to when we called the doctor was 15 minutes. You think that's too slow for me to let the when I'm over here suctioning the guy,
Right.
and this guy's,
Trying to save a life.
I'm
I'm
taking
not
care
worried
of the
about
patient.
calling somebody else right now. Because that person isn't going to be here and the patient's not going to be here anyway. It's really just giving them a heads up. So like,
But that's one of the things that really irritates me with the state is the fact that we are put so much under a microscope, and you have so many armchair quarterbacks reading your documentation and not really putting themselves in that situation. You're always defending what you are doing.
yeah.
And it's like, no, the guy's alive, is he not? But did you die? Like it's like, and that's the one thing. But it also makes me a better supervisor because when I do the reviews, I always try to see, okay, put myself in that situation.
Right. Right.
What's that nurse thinking,
Yes.
And yeah, that type of stuff
So
with the
what do you
state.
do when you have those sorts of things going on, right? When you have patients that almost code and then get chastised and honestly, your energy is up, right? And you're in a heightened state yourself. So what do you do in order to kind of help yourself come back into stasis and to find your own balance, find
You
relief
know,
of all that stress and that overwhelm and that anxiety from being in those highly stressful situations.
sometimes when people are put in a fight or flight mode like that, it's mainly due to inexperience, and they doubt themselves, and they kind of just shut down like so much is happening, I don't know what to do. So, and that even happened to me recently, when I had a stabbing victim I was helping take care of because it was only me and one other RN in the TTA. Again, staffing issues in the TTA, and he had blood coming from everywhere.
Mhm.
And I'm like, I've never seen so much blood in my life. And I'm like, oh my God, he must have some type of severe chest wound, right? I'm looking, he's got hyphen-vented chest seals everywhere on his back, right? I'm like, this guy's got to go. And then I'm thinking, okay, first thing, established IV, right? You got to go back to your training,
Good.
right?
Yeah.
So I almost felt overwhelmed, but I took a step back, took a deep breath, and said, okay, we got a bleeding victim. If he's got holes, we got to plug them. Okay, they're plugged, right? I already see it. Okay, if he's losing a lot of blood, we got to replace it, right? So we got to start an IV. And I'm like, oh my God, there's no way I'm going to get an IV in this guy. He's like, first of all, that it's hard working in corrections because they're always cuffed. So
Yeah.
the officers had him cuffed behind his back. You know what? I'm like, he's bleeding so much. I'm not even going to mess around with a IV. I went straight to IO.
Yeah.
And then I'm like, crap, where's the IO? I
Yeah.
don't even know where they keep it here because it's been so long. Because I had just got back from maternity leave and I hadn't worked in the TTA for 3 years. So I was like, okay, I know they usually keep it in the crash cart, so I'm like, all right, go get it. And so I had the nurse go, I mean, the LVN helping out, I had her go grab it and never done an IO before in my life on a real person, only on the mannequins.
Yeah.
But it was pretty dang lifelike.
Yeah.
Those mannequins were actually it went in just like it did in the
Yeah.
mannequin. It was pretty awesome, and it was pretty cool to do that as my first. And then pretty much just right when all that happened, you know, the ambulance team got there and I just gave report. But it's one of those things that when you're in that fight or flight mode, you really have to have, if you don't know it, take a step back and utilize your resources. If you have other people around, ask questions. Don't shut down and do nothing because doing nothing doesn't help anybody.
Right. Right. What about though when
So,
you leave, when you went home? Like, kind of like, are you able to really compartmentalize? 'Cause I know a lot of times that's what we do. You're like, all right, this is at work, leave it there. But
yeah,
some residual of that follows us, and how do
it's
you, yeah,
crazy. I honestly didn't, and I honestly didn't let it affect me that much because I'm thinking to myself, he left there breathing and with a pulse.
yeah. And I
So
did the best I
I
could
did
do. I did,
something right.
yes.
Yep. And the it just so happens all the blood that was coming out of his mouth was because the guy got stabbed through his tongue, and there's
Oh,
a major artery in the
yeah.
tongue. So it wasn't even he was satting completely fine. His lungs were he didn't have one puncture wound in his lungs. They were all pretty superficial or just not in the lung spaces.
Mhm.
So that was I mean, that was pretty
That's new.
fortunate
I
for
haven't
me that
really heard of anyone being stabbed like through the face, through
I
the tongue. So that's different.
he was
Oh, I see. Yeah.
like
Like
through the
yeah.
cheek, and then the blade was about a 9-inch blade apparently.
Wow.
Yeah. So, and the guy lived and it was, you know, I was following his care because we always get the hospital reports from our utilization management nurse. So every day we get an update of what they did in the hospital. And it turned out, which was neat, the EMTs, in order to stop the clotting on the tongue, they put quick clot in there,
Huh.
just the gauze. And I'm like, well, I can't do that because that would block his airway. But
Yeah.
they were able to intubate him, then stick
Right.
the
So
quick.
then they could do. Oh,
I
yeah.
couldn't have gotten a king airway in there because
No.
I don't have a scope. It was filling up with too much fluid. But that's why EMTs know it better.
No, thank God for EMTs. They do. Yeah. When you get a good EMT, oh yeah, they know some
Yeah.
life-saving stuff. Well, so I know we're coming to the top of the hour here, and I just really wanted to thank you for being here and being present because I know you have all these other duties, not only being a supervisor and jumping in to be a line staff at times, but you're also a new mommy to beautiful little
Yes.
girl. And I know you've got your fiance as well. So
Yeah.
I want to honor your time and make sure that you have the ability to sit back and enjoy, the fruits of your labor, literally, and also just, the labor of creating the life that you currently live and get to experience with your loved ones. But before we do go, I just want to remind everyone and that if you are interested in learning more of these types of skills, leadership skills, how to say no and still have fun and come across as being loving and caring, understanding how to create ways of safety for yourself and of looking after yourself and your own needs in addition to those that you care for, so you're no longer on the back burner, how to deal with being in a crisis like Denise is often without losing your head and your mind over it. And so if any of that interests you, please go ahead and reach out to me in regards to joining our next Nurse Resilience event. I will also leave a link for you in the chat and in the comments. And Denise, was there anything you wanted to say before we head off for the evening?
Just, be confident, be happy, and, know that if you're in the profession you're in because you have passion and compassion for caring for people. And, don't let the negativity always get to you. Always remember that you're great at what you do. And
And
if
you're here
you
for a
truly,
purpose.
and
Yeah.
you're there for a purpose, and don't sweat the small stuff.
Yes, that's perfectly said. So I'm going to just go ahead and thank everyone who came on and had a chance to view this with us. And I'll say good night to Denise and to our Facebook fam, and we'll see you later. So let me give a moment here. I'm trying to see how to, there it is.